organizations read off, I was like, wow, these are my people. So medical professionals, soldiers, educators, cutting-edge innovators, what's being done here is so impressive. And then as I've heard the conversations, even just this morning, a common theme I've heard is service. And so I wanted to just speak a few minutes today about the value of service and the value of having a why, and what does that mean for us moving forward during these really dynamic times in our nation's history. So for me, service really resonates. And I'm going to be quite transparent with you this morning. I can't tell you that I was born with that as a value, or even it was something that I understood when I was very young. Because I joined the Army really because of what the Army had to offer me. I graduated from college bright-eyed, bushy-tailed, and idealistic with an acceptance to medical school in one hand and absolutely nothing in the other hand. I have no idea how I even drove down to get to med school. But I knew when I went in and asked the loan officers about how to finance my dream the first day, they wanted a lot of money to do that. And I'm from New England, and we call it frugal. It's not cheap, we're frugal. And so when he said a big number, the folks from the Army were across the hall, and I went and chatted with them. And they told me they would give me money to help finance my medical education. They would help me stay in shape. They would give me a chance to travel, and they would even give me a job when I was out. And so I signed up for 3 years. Now you might be able to guess after hearing the intro, I've been in the Army for more than 3 years. And what kept me was the service. What kept me was the ability to care for soldiers. And many of you know soldiers, airmen, sailors, those people who are willing to put their lives on the line, to sacrifice for the freedoms that we enjoy. And so, to me, that's what service is all about. And then I had the opportunity to serve with others who shared those values. And I had the opportunity to do hard things downrange in other places that I would have never had the privilege of going before. And so this idea of service is so integral to what we in the military do. And again, just walking amongst you this morning, I can feel that's really important to this community as well. So I feel like this is a really perfect marriage of bringing that together. And so the healthcare piece of it, where you take your time and you commit. I know that as I talked to your mayor this morning, he expressed to me the phenomenal law enforcement culture that you have here, and the way your community cares for each other. That's really important. And though I will tell you, when I first came in the Army, I really didn't know about all the different opportunities. I thought, again, I was going to be a doctor, I was going to take care of people for a few years and then go settle down somewhere. But then there was that sense of both service and fulfillment, because through my military career, I had the chance, as you heard, to get a master's in public health. And I was able to use that in Afghanistan, where as a young major, somebody, gosh, in my 30s, so just a year or two ago, I was able to work with people who we didn't necessarily share a spoken language at first, but we shared that desire to see the public health of the community be better. And so in the Army, I was able to serve by working on a healthcare plan for an entire country to help decrease maternal mortality, to increase the lifespan of their children, and therefore to increase the opportunities that they could have to experience some of the same joys that we have here in America. And that's not all. In the Army, we have scientists who are on the cutting edge, who innovate. Things like addressing yellow fever. Way back when, we allowed that to be treated because of science in the military. And even more recently during COVID, you saw Operation Warp Speed, where military scientists came together to support our entire nation through development of treatments and development of vaccines that helped to get a pandemic which really impacted all of us back in the box, so to speak. And we continue to do this as we innovate with wartime and also treatments that are used right here in our communities as far as how our emergency responders do that. So one thing I'd love to share today is all the opportunities to serve that are within the military. And while we are in, again, dynamic times, I think that those are important areas where we can think of where could our young people serve. Sometimes it's full-time. Get to wear, I do not have to pick out what to wear most days. It's pretty handy. It's pretty handy. The Army takes care of that for me. Or sometimes it's in our reserve component. And that's another area with all the fantastic healthcare organizations that you have in this community. I would ask people to think, are there ways that you'd like to serve in the reserves? To be able to bring the talent and the innovation and the academic excellence that you foster here, bring it to bear for the benefit of our soldiers around our nation and around our world. And we have opportunities, everything from our medics, our 68 whiskeys who are out there on the front lines, all the way up to the folks that are working in our medical centers. Because if you want to have a life that has variety and interest and intrigue and sometimes some tough problems to solve, no doubt about it, the military provides many great opportunities for that. And so, and again, you are already familiar with this because you have people in your community that do just that. So I had the chance to meet Dr. Cal this morning, and what a phenomenal leader. He's a prime example of someone who brought the skills that he gained in the military and brought them back home to your community. So he mentioned he served more than 10 years honorably in the United States Air Force, deploying to Iraq and Afghanistan, playing a crucial role in treating and saving the lives of our servicemen and servicewomen overseas. So there are a lot of skills that you can gain in the military that you can bring back and enrich your own community. And that includes this commitment to service, this idea for being used locally. And so following his military service, he opened his private medical practice, providing healthcare to a diverse variety of patients. And then he hasn't just taken care of individual patients, he's done work with the HIV Commission, Arcadia Senior Citizens Commission, and then most recently continuing his service as mayor. So it is an honor to serve with you, and I'm sure he's one example of many in your community who have melded that service to our nation, our military, and our local community. And so, and that continues as well. And so I don't know if we have Annie here.